Hello fellow toxicology aspirants. Sorry for my absence last week. As some of you have already found out, and most of you will eventually find out, life happens. And it always seems to happen at the most unfortunate time. But that is past, and I am back on the proverbial horse again. Let's talk about weeks 1, 2 and 3. Already, as happens every time I teach this course, half the class doesn't quite grasp the significance of studying poisonings the entire time. I saw lots of discussion posts about how many of you purport to have never seen a case of poisoning in your career. I beg to differ. If you work in the emergency department or urgent care, you probably were not thrown off course as you have seen plenty of patients that we usually consider as poisonings. Yeah, but I have always worked in dermatology. I loved the post about Botox poisoning. According to the World Medical Reference, Wikipedia, Botox is a neurotoxic protein produced by the bacterium Clostridium botulinum and related species. It prevents the release of the neurotransmitter acetylcholine from axon endings at the neuromuscular junction and thus causes flaccid paralysis. Yeah, that probably qualifies as a case of poisoning. Intentional poisoning. By you, the provider. On purpose. Wow. Many of you have been in ortho or cardiovascular surgery and claim to not have much experience with poisoning. I beg to differ. Some, but not all, of you caught on to the fact that some of the most insidious occult poisonings you see are Tylenol, ibuprofen, and opioids. I am guessing surgery practices prescribe plenty of each. Yes, but I am in education and no longer seeing patients. I can't possibly use this information. Now listen up. Because I am only going to say this once. Yes, you can. Do you spend any time outdoors? If so, it is not unlikely you, or one of your family, or maybe just somebody you run into, will be exposed to an injected poison. I once had a student who was an ICU nurse in San Diego. She told me a story about a forensic pathologist who was at Disneyland with her family. While standing in line at one of the rides, she dropped her ticket and it landed in a bush. She reached in to get it, and came out with a brilliantly banded snake holding onto her hand. She removed the snake, threw it back down, and it went back under the bush. As a pathologist, she realized it was a coral snake, but also knew the chance of envenomation from coral snakes was small, unless allowed to hold on for very long. Nonetheless, she finished her day at Disneyland, and the family went to San Diego that evening. The next morning she went to look in the mirror and noticed she had significant ptosis of her left eye. Going quickly to the nearby ER, she was admitted into the ICU and watched for 24 hours. There was no further progression of signs or symptoms, so no further care was necessary. See? An actual case of poisoning outside of work. Not to mention the chance you will see somebody, or a pet, get into the poisons under your sink, in your garden shed, under the hood of your car, and the local buffet, or almost certainly with each and every one of the prescriptions you write for a patient, or fill for yourself. So I do not want to hear any more complaining and sniveling. No crying. There is no crying in my courses. Just sit back, think outside the box, and enjoy the ride. We are in the presence of some amazing colleagues who can teach us all a lot. Let's take advantage of each of you. Don't be afraid to just go with what feels right. Have fun. I will see you in a few. Oh, and by the way, why was there an eastern coral snake in a bush at Disneyland? Turns out they grow many of the plants in Disney World for transplant to Disneyland. Coral snakes are definitely more common in Florida than in California. Assuming the snake was a male, it was just another case of a Florida man who,